Welcome to Anecdotal Evidence, the podcast series sponsored by the American Institute of Dental Public Health. I'm your host, Annalise Cothran, Program Director for AIDPH. The mission of AIDPH is to advance the science and education of dental public health. As a public health organization, we want to provide students and professionals with helpful resources to support their work, which is why we started Anecdotal Evidence. Anecdotal Evidence is a public health-oriented podcast inviting leaders in oral health and public health to share their stories, focusing on topics like evidence-based practice, leadership, cultural responsiveness, mentorship and collaboration. Conversations with national leaders invite bold and innovative responses to emerging public health trends.
Being the chief health strategist is a mindset. You have to decide that if it hurts people or kills people, it's yours. Important, because if you don't have that fundamental understanding, then you're very likely not to take on issues that hurt people and kill people, to which you may have enormous influence. So that includes moving for public health, moving way upstream, looking at the built environment, looking at climate, looking at the way people think about things, helping people understand health literacy. A lot of the things that we know are fundamental to good health that occur outside the doctor's office requires leadership.
Well, what I would love to see is for us to, like in our public health training programs, for us to put as much emphasis on leadership as we do on biostatistics, for example. And I say that as a former course director of biostatistics, no dissing there, but leadership qualities and developing people's leadership skills is just as important as the rigor that's brought to the didactic work.
We're excited to share this series with you. Download, subscribe, and share wherever you get your podcasts, and follow us on Twitter and Facebook to weigh in on topics you want to hear more about this season. You don't want to miss what we have in store.